Glaucoma is a disease of the back of the eye where pressure causes damage to the nerve. Now, the job of the nerve is to pass information from the eye to the brain. And if the nerve is damaged, then sadly, the information can be sent incorrectly, and so that can damage your vision. One of the things we tend to do a lot in glaucoma is measure your vision using a visual field test. So while people may be familiar with the vision chart in the opticians, which measures the accuracy of your vision, the visual field test helps to build up a map of the quantity of your vision. Glaucoma is quite insidious in the sense that it creeps up on you, and a lot of people don't realise they've got glaucoma until very late. So it's very important that people do go to their opticians on a regular basis so that they can have the early signs of glaucoma detected and they can then be referred for appropriate treatment. And there really isn't any symptoms. There are rare forms of glaucoma which may present with symptoms, which include pain around the eye, misting or fogging of the vision, and a feeling of being sick or indeed actually being sick. In fact, these symptoms can be mistaken for migraine, but they may not be. They may be signs of an acute rise in pressure. As I say, it is rare that people will experience these symptoms, but if you do get those symptoms, that is something that can be identified, and if it is glaucoma, then that can be treated. And it tends to be more common in people who've got a family history. So if you've got a parent or a sibling who has glaucoma, then while the risk is still small, your risk is more than the background population, so it is something that you should look out for. The vast majority of people with glaucoma are quite capable of being managed with eye drops, and eye drops are safe and very well tolerated in most people, but for some people, either because the drops on their own are not enough, or because the drops are causing too many side effects, or indeed it's just simply too difficult for them to remember or to physically get the drops into their eyes, then surgery is what's required. Downside to surgery is that obviously there are risks associated with surgery, and up until recently, surgery's been quite invasive, very powerful, but perhaps more risky than some people would like. In the last 4 to 5 years, there's been an increase in the number of what we call MIGS procedures, or minimally invasive glaucoma surgery procedures, and they're intended as a faster, arguably safer, but perhaps slightly less potent form of surgery, which for some patients may be exactly what they need, something that is stronger than the drops, but not quite as risky as a big glaucoma operation. I suppose specific to glaucoma, there's not really a lot that you can do lifestyle-wise. There is some evidence to suggest that glaucoma is partly related to circulation, but fundamentally the biggest thing people can do is simply see their optician on a regular basis. That's usually once every 2 years, or in the case of someone who has a family history of glaucoma, once every 1 year. And the reason why I say that is because a lot of people with glaucoma can have very good central vision. So they think they can see fine on the chart, or they think they can see fine when they're driving, all the while the glaucoma is causing damage. So just because you think your vision is okay, it shouldn't be a reason not to go to the optician. Regular eye checks with the optician should pick up the early signs of glaucoma, and then patients can be referred to us for diagnosis and further management as appropriate.
And with it being World Glaucoma Week, one sentence of advice, what would that be?
Just look after your eyes, you only get one pair.